diabetes and, heart attacks and cardiovascular disease. I mean, that it really is this whole idea that that it's all about the fats. I mean, actually, when we went low fat and increased all the sugars is when all the problems with diabetes and insulin resistance and heart attacks came up. I mean, I love, I'm sure you know the cardiologist down the way, John Scheinberg. Yeah, so, I mean, we were just talking and he was showing me a, panel that he did for something, because, and this person probably should be on a paleo diet. And I just tapped him on the arm. I was like, oh man, you're the man after my heart. I mean, after my own heart. I'm going to send people here, because I basically follow a paleo diet, and that's what I recommend for people, low carbs, because all that, insulin is just creating inflammation in people. And it's really not it's not the actual cholesterol from an egg or from grass-fed beef. If you're eating, organic grass-fed beef and doing it in an environmentally friendly way, I mean, you want to, I want to be sensitive to all those things, but it really is, yes, it really is about the carbs and the spikes in the blood sugar. And I mean, they're realizing cancers feed off of sugar now. So it really, sugar is not a good thing, no matter what form it's coming in.
Well, the other thing too is, and I see a lot of it, is that people come in and, you're taking this while I'm pre-diabetic. Well, nothing's being done.
Right.
And then they're just waiting to become diabetic, and then the medicine comes.
Right. Because we don't, as you know, we're not taught in medical school how to do that.
You're right. I mean, I'm just saying that, it's if the changes can be made then in pre-diabetes, to avoid, well, now you need to go on metformin, or you need to do this, or you need to do that. So.
Yeah, I had a patient, her son was having some issues off at college and went and got tested for celiac, and they did a scope on him and did a biopsy, and they said, well, you don't have celiac yet, but you're really kind of on the verge of it. And he says, all right, well, what do I do? Do I need to give up gluten? And they said, no, not yet. Oh my God. So his mother, wanted me to write a note to the nurse, recommending, even though I'd never seen him, that he really needed to be gluten-free. I said, that is utter insanity, that it's like, waiting for the disease, just like you said, to then tell you, no, you don't have celiac yet, but I can tell that it's damaging your gut, and at some point you're going to, so let's just wait till you have it and then get off the gluten. We're just, I mean, as you know, we're taught no nutrition in medical school, nothing about prevention. I mean, the whole system is not based on preventing disease. If we prevented disease, then most of these people would be out of business here.
But you can determine celiac disease, I mean, by your testing rather than being scoped.
Yep. So what I do for gluten, I mean, there's what I tell people is there's the spectrum of illness with celiac. I mean, with gluten, there is no disease, and there's celiac, and there's an enormous range in between. You could be one step away from nothing or one step towards celiac. Most people do not have celiac. Most of the people I see have a gluten issue. So what I do to determine it is, yes, we can do a blood test to see if you have the genetic markers for celiac, and we can do a blood test to see if there's been some damage to your gut. But the other thing, I don't do those very frequently unless somebody requests it. Right. What I do, because it gives the people a false sense of, well, I don't have that. What I do is have them take it out of their diet for a couple of weeks and then add it back in.
I see.
And your body is going to tell you if you have a problem with gluten. That's the number one way. And then in the stool test that we do, there is a marker for to see if your body is responding to gluten. So there's an anti-gliadin marker in the stool test, as well as I look to see if people are having fat malabsorption and digestion, which I pick up a lot on this test, and that can come from gluten. So there are clues. And then we also do a blood test that which is the IgG test to see if you have a gluten sensitivity. So I use all three of those things in conjunction, but the number one thing, and what I say to everybody that they can just go do on their own, which is completely free and very easy, get it out of your diet for a couple of weeks and add it back in. Now, you have to be careful because you really have to be 100% gluten-free. And gluten is in a lot of things, and it's in a lot of things under different names. Maltodextrin and things like that. I mean, if you're taking medications, it could be in the medication. I mean, if you go try to get an aspirin, I had to get an aspirin for something. There's nothing out there that is just aspirin and nothing else. I mean, it all has fillers and colors and all kinds of stuff in it. So, Dyes, yeah. I mean, maltodextrin has all this stuff in it. So, so you have to be very careful in things that some people don't think of. They'll go out to eat and they have some soy sauce and they're not thinking that there's wheat in the soy sauce. So it is as easy as I say to get it out of your diet for 2 weeks or so on your own at home, that is why I have Brienne here, is because it is a very complex, issue that it can sort of go on and on. There are actually gliadins in all grains. So really the only, isomer that we're looking at is gluten. But that's one of about 12. And there are gliadins in all grains, which is the whole theory behind paleo diets and giving up all grains, is that some people can either be reacting to those gliadins, or like with oats, they could physically be cross-contaminated with gluten just through the process.
I see.
So it can be a little overwhelming, to do that at home alone, which is why we have a nutritionist on staff to help with that. But for the average person, just cutting down on the beer and bread and pasta for a while and then adding it back in, you can actually tell if you have a problem. You should be able to tell something.